Okay, well, Dr. Smith, thank you for your time. Welcome to my CLP studios. As you can see with the times right now, we're making our best attempt on keeping our social distance and keeping the process moving. So the show is yours, the platform's yours. Dr. Smith, how is Ultimate Bariatrics holding up?
We're doing good. We're embracing new technology, which isn't always easy for an old dog like me. So basically, as many of our people that can work from home are working from home. The only people we are physically seeing in the office are people that actually need hands-on care. So an example of that would be someone that has a lap band that is too tight and they're throwing up or having horrible reflux. Those patients, the benefit exceeds the risk of them coming in and being seen. So we're doing deflates, but we're not doing inflates. So yeah, if you know you need a fill and you're eating too much and you're not getting that early satiety and stuff, yes, you do need a fill, but that benefit doesn't exceed the risk of getting out. So we're asking you to stay at home until the governor says it's okay for us to do elective procedures. And this is coming from the Texas Medical Board and the governor's office. We're trying to do our very best to be good partners in the overall healthcare system so that we're not consuming resources that can be used for people that get sick. We're not putting anybody at risk of getting sick. And last but not least, we're not putting our employees and our friends and our colleagues at risk either. So how are we handling that? So let's say you're a 1 week or an 8 week or a 6 month post-op patient after a bypass or a switch or a sleeve. Unless you're having a complication that requires hands-on care like a wound issue or something like that, we're doing that telemed. If you're an iPhone person, we're having pretty good luck with FaceTime. And if you're an Android person, we're using Google Duo, which to me is the same thing as FaceTime. I'm sure there's a subtle difference. But and we're doing new consults. If you're someone out there that's searching or inquiring, and it's like, man, I wish I'd have gone in and had an appointment because now I'm stuck at home and I can't do anything. That's not the case. You can start the process. In fact, I met 4 or 5 new people this morning that want to start the process, that they've decided, I'm going to take charge, I'm going to move forward, I'm going to work towards having a weight loss intervention. Whether that be a band or a sleeve or a bypass or a switch, we can get you started. Now, of course, before you have your surgery, we want to see you in person. I mean, I wouldn't let anyone operate on me that I had never seen, and I would expect the same from you. But we will start you through the process and do as much as humanly possible online, FaceTime, Duo, however, so that you don't lose any track or you don't lose any ground. We do have people that have approvals for surgery. We're making sure, and the governor, as well as the president, is putting pressure on insurance companies not to like expire or drop these pre-certs. So we're making sure that the insurance company doesn't do any tomfoolery on us here on people that are approved and had to have their case either postponed or canceled temporarily or whatever because of the safe distancing. And that's the smart thing to do. I salute and respect our governor and the Texas Medical Board and everybody. And I think everyone is really pulling together in this to do the best we possibly can to make the experience in Texas as safe as possible, minimize the number of people infected, minimize the number of mortalities from this thing. And the reason we're doing that, it isn't like our facilities are taking care of COVID patients, because they're not. I mean, where we do our surgeries, they're just surgery places. They don't take care of medically ill patients. But we don't want to consume resources that could be used for somebody else. And the machines that we use in the OR, if worse comes to worse, then they can be used in another hospital for someone that needs to be on a ventilator. Our mask, our gowns, our gloves, everything in a pinch can be used. But if we consumed them by doing elective surgeries, then they wouldn't be available should the worst case scenario occur. So we're trying to be partners in this fight against COVID-19, just like we ask all of our patients, don't come in if you absolutely don't have to. Don't leave home. An example is you may feel perfectly fine And you may decide, man, I'm sick of being in the house. I think I'm going to go out and just have a cup of coffee with my friend across town. Well, that friend feels perfectly fine too, but their daughter went and had a sleepover at their friend's house who also felt good but had been exposed to somebody that had COVID. So now that one person has exposed maybe 10 other people. And then those 10 people expose another 10 other people. You can see how this can escalate because it takes so long for you to get symptoms from this thing. You're exposed way, way, way before you ever have a symptom. And it's not like we have a test in every house and every car and every garage. The tests are being produced rapidly, but they're not readily available yet. They're being reserved for people that meet strict criteria. So please stay home. And if you have to go alone. If you have to go to the grocery store, don't take mom, dad, cousin Sally, and the dog with you to the grocery store. Only one person go in there and get what you need. Same thing for the pharmacy. Same thing. Be safe. People ask me questions, and I want to clarify, I am in no way, shape, or form an infectious disease expert. I'm just going off of what I'm reading off of the Tarrant County Health Department's website and CDC website. They say, should I go buy a mask? No, stay home. A mask really isn't going to protect you. If you're infected, wearing a mask then prevents you from spewing, copious amounts of sneeze or cough on somebody. But you, if you're not sick, wearing a mask, then you're more likely to touch your face. And I didn't touch my face. I just went in that general direction. Then you're more likely to touch your face if you're wearing a mask than if you're not wearing a mask. The safest thing you can do is maintain 6 to 10 feet between you and anybody else. Don't rush the checker or the cashier at the grocery store when you do go by yourself to the grocery store. Same thing if you absolutely have to come to the office. We're doing everything humanly possible to keep you by yourself, to keep you separate from everybody until that absolute minimum amount of contact can be made. So to kind of sum everything up, I honestly hope and pray in my heart that the worst of this will come and pass here in the next week or so. And hopefully by the first week of May, we'll be at least those of us that are still well and are able to go back to work. I think it's going to be an incremental thing, but I think once that the health department officials and the state department or the state officials see that we do have adequate supplies, adequate capability to take care of people that are sick, then I think little by little, they're going to let us do the surgeries that we need to do. Because yes, it is elective surgery, but it is a necessary surgery. It needs to be done. If you've worked so hard to get approved and ready to go, it's very frustrating not to proceed when you're ready. So we are altering a little bit of our routine. We're not wanting you to stay on a liquid diet until the governor says we can do surgery again. We just want you to stay on a healthy, low-fat, low-carb diet during this period of time. Now, that's hard because when we're stressful, we like to eat those carbs, but don't do it. Be healthy, eat healthy. We're going to try to keep you updated periodically. The other docs are going to try to put some things on that you can do at home and some exercise suggestions and things like that. So we're all going to get through this together. We're going to work extra super hard to get everyone's surgery done as fast as humanly possible once they give us the green light. So don't think, oh my gosh, it's going to be months and months and months before I have my surgery. That ain't going to be that. I don't care if I have to work Saturday and Sunday. We're going to get your surgery done. So stay home, be safe, pray for our leaders, pray for our country, pray for a quick end to this thing, and reach out to us if you have any questions or problems. There is someone in the office every day. Just in case someone absolutely has to come in or that we can do prescriptions and things like that. Otherwise, if you need us, we'll reach out to you just like I'm reaching out here now. So, see you soon.